Hello and welcome to the 2022-2023 River Subs Employee Benefits presentation. My name is Ben. I work for a company called Catto&Catto or Hub. We go by both names. And I'm an insurance nerd. I'm going to be walking you through this presentation. So as you see me look out that way, I'm not staring through a window. It is a different screen where I'm going to guide us through this presentation. We're going to be covering a lot of ground today, but we're going to be doing so relatively quickly. Medical, dental, life insurance, disability, legal services, and COBRA. COBRA just means you can take this with you if you leave. Before we get, oops, click the wrong button too quick. Before we get into any of the benefits themselves, open enrollment is right now. You can make any change in your benefits that you would like to make. Outside of open enrollment, you have to have what's called a qualifying life event. So those would be things like marriage, divorce, birth of a baby, spouses open enrollment. Outside of that, what you pick sticks for 1 year. So the IRS says we can have these reasons in the middle of the year to change, but if one of these isn't your reason, then what you pick sticks for 1 year. We did make a change in terms of medical. We had been with Humana for a while. We moved to Blue Cross Blue Shield because they gave us the best deal. We evaluated that in the open market, and Blue Cross came through at a much better price than Humana was willing to do. We're always sensitive about that because we don't want to change just to change. But we are very focused on price and benefit and value. So you've got two plans. Let me explain what they are. So we've got Blue Cross Blue Shield. We'll send the policy number out as soon as we get it. The network is their most exhaustive one. And that's the thing to remember when you seek care. Are you in my network is the question. Blue Choice PPO. You've got an HSA style plan, and then you have a copay style plan. Both you can get more information on Blue Cross Blue Shield, bcbstx.com. Preventive services, what I'm scrolling over here, mammograms, pap smears, childhood immunizations, colonoscopy if you're a guy over age 50, yay, those are freebies on the plan. Now let's talk about if you go to a doctor. If you're on the HSA plan, it will work exactly like mine does. I actually have a Blue Cross HSA as well. So here's how it works. If the doctor bills $200, making up that number, if the doctor bills $200 and the network discount for Blue Choice PPO is 50%, so $200, you get $100 off, then that $100 bill to see the doctor gets applied towards this number here, out-of-pocket max. So you've got your deductible and then you've got your out-of-pocket max. So those are still big numbers, right? But you can arrange a payment plan if you're in a facility or a hospital. I've done that before. So that'll make a little more sense as we go through a couple of more examples as well. But this is just how to see a doctor. Whereas if you're on this plan, you've got Blue Choice PPO, same network, but when you go to the doctor, it's on a copay. That's all it is. So copay is just a flat rate when you use it. This does not have copays. It still has a network discount applied, but it is not a flat rate. So whatever the network discount is, it's usually somewhere between 50 and sometimes 60% off of the billed charge. And so you pay the remaining balance in the doctor setting. Same applies for retail clinics. Those are kind of in strip centers a lot. Or like walk-in places. Virtual visits both have a copay, so that's just a flat rate. That's 24/7, 365. The vendor is called MD Live. They're integrated with Blue Cross Blue Shield, but that's who you call. Great for hack, cold, sneeze. Great for kiddos who have an eye infection or pink eye or something like that. I've used mine for that before. So that's $44 on the base plan, and then on this copay plan, we've got it at a $0 copay, which is pretty cool. Okay, your deductible. Now, those start over in January. That isn't necessarily new. Depending on how much of your deductible you met with Humana, we want to make sure that that same amount gets applied to Blue Cross because we're moving in the middle of the year, not on January 1st. And so the deductibles always run January to December. So the base plan has a $4,500 deductible. The mid plan here has a $2,500 deductible. So one of the reasons the mid plan is going to be more expensive is because it has a lower deductible when you go into a hospital, typically is where that's asked. Now, What happens after the deductible? See this 20%? I'm scrolling over right here. Once you meet your deductible, then you're sharing costs. You're paying 20% of all the bills coming at you. And they don't come perfectly gift wrapped, right? They come onesies and twosies. And you keep paying that 20 cents on the dollar until your 20 cents on the dollar is exhausted, because you are capped out on this plan on an individual basis for covered in-network services at $6,900 a year and $5,500 a year. So once you meet your deductible, then you pay 20 cents on the dollar. Once that 20 cents on the dollar adds up, you are capped at the deductible plus your 20 cents on the dollar of your out-of-pocket maximum. The easy math on this mid plan is $2,500, and you've got $5,500 worth of exposure, which means that 20% would have to be $3,000. 2,500 plus 3,000 equals 5,500. That's how that works. Now, what happens if you go to get a prescription? So this is going to look a little confusing because it kind of is. So the HSA plan works the same as mine. You'll need to meet your deductible first, and you'd only realistically do that if you had a really expensive drug, and then you're sharing cost at these percentages depending on what the drug is. But when I go to fill my prescription, I will get a network discount, and then the leftover balance will be applied to my out-of-pocket maximum. That's the same way that it would work for you. And I chose that because I wanted the least expensive insurance premium. But I also am aware that when I go into the office visit, or when I get a prescription, then I'm not paying a copay. Copay is just that flat rate. Whereas you can see on this plan, you've got preferred and non-preferred. I'll speak to that. And these are all on copay. So it's flat rate depending on what the drug is. So just the difference between preferred and non-preferred is geography. CVS, I'm going to click to this. I'll go back to those. CVS is not in the network. Let's see, we don't have it there, but they're not. So they had a $70 billion merger with Aetna, so they are not in the network. So a preferred you go to HEB, Walgreens, places like that would be preferred locations. Okay, so we've got the next two plans. We've got 4 plans total, cover the first 2. These other 2 are copays also when you go to the doctor, and copays when you get a prescription. Their deductibles are going to be lower than the ones on the previous page. So $4,500 individual, $2,500 individual, and then we've got the buy-up and then the premium buy-up. So those deductibles are just going to go down like that, and so therefore the price is going to increase. You've got the same level of copays when you go into the doctor, or retail, or virtual, and then same copays here on prescriptions. So the difference here is going to be this buy-up plan, $2,000, and then you've got coinsurance. That's your 20 cents on the dollar, but it's a $5,000 annual maximum liability. On this premium buy-up, it's a $1,500 annual maximum liability with a much lower deductible. So they're like a seesaw. The lower the deductible in out-of-pocket maximum, the higher the premium or the cost. The higher the deductible in out-of-pocket max, the lower the cost. Oh, here we go. This is where we list out some prescriptions. Where to get them: HEB, Walgreens, Walmart, Sam's, Brookshire, Access Health, places like that. So Blue Cross has had, will always have if you have a generic and a name brand in a prescription drug and you want the name brand, then they're going to make you pay the difference between the generic and the name brand. If there's only a name brand, you get the name brand. But if you do have a generic and a name brand, you can get the name brand. You just got to write, the doctor has to write dispense as written if there's a generic available. Okay, so you can get it, but they've got to write DAW. Here's the cost. So it's based on tenure, 0 to 5, 6 to 10, 11 plus, and then you've got the cost by employee, employee plus sweetie, employee plus kiddos, full meal deal. So the cost will go up from the bottom right here, and then the mid plan will be more expensive than the base, the buy-up more expensive than the mid, premium buy-up more expensive than the buy-up. That's how that works. Friendly reminder, hospital rooms are very expensive and they only treat you if you're life or limb threatening. There are freestanding ERs, which is an ER outside of a hospital. And unless you're really paying attention, some folks have thought they were walking into an urgent care. They actually walked into a freestanding ER, sought some services that were not an emergency situation, and they got a big old bill with it. So just be aware of where you are accessing care. This is MD Live. This is the virtual visits. I do not look this happy, neither do my kids when I'm sick. This lady looks very peaceful because she's speaking with the doctor anytime, anywhere. MD Live, 24/7, 365. These are good reasons to call MD Live. Things in this category. They have an app, they've got a phone, you can access them on the computer. I've used them before. It's pretty good in a pinch. Some ways where you can earn, they're called blue points. You can get discounts and extra stuff by completing health assessments every 6 months, and they all rack up to get you some goodies from Blue Cross. This is a discount program, iMed Vision discount program. So it's like a big Blue Cross coupon. That's what it's like. So you can check out here. I don't cover the every single word in this presentation, y'all. Just trying to be mindful of your time. But if you have any questions, this is all we do. Please just reach out to us if you have any questions. So these would be some examples of the discounts that you would get through Blue Cross on iMed Vision. They've got an app. How about that? So right there, or you can just text it and then they'll send it to you and get signed up. Voluntary supplemental benefit plans. That's a lot of adjectives. They're with AFLAC. So if you've seen a quacking duck, you're in good company. Okay, there are 4 plans. There's going to be quite a bit of information. I'm going to stick on this just for sake of it being a little easier to absorb. Critical illness, heart attack, stroke, things like that. If, God forbid, that's a diagnosis, then AFLAC sends money to your mailbox upon that diagnosis. Hospital indemnity, you're actually paying AFLAC a premium. If you go into the hospital, they pay you. If you are there, it's usually over 20 or 24 hours. You got to be in there, like you can't go in and just leave in a couple hours. Usually have to be there overnight. So they actually send money to your mailbox if you go into the hospital. That's what you're paying a premium for. That's where it's going. Cancer, God forbid this should be a diagnosis, but it pays to your mailbox. If that isn't diagnosis, the accident plan, I've had one of these for a while because I've got kids in sports. So it pays based upon severity of the injury. That's how that works. And so there's going to be a lot of information. This is cancer, and it can be a ton of information. So really and truly, please reach out. This is the hospital confinement or hospital indemnity plan. That's the one that pays you if you go into a hospital. Critical care. So these would be things like heart attack and stroke. This is the accident plan. And it's just kind of interesting to see a dislocation is $100 to $37.50. So it's called a defined benefit plan. Okay, rates for accident. This is 24 hours, so that's pretty cool. That's all day. Here's the rates for the cancer. Here's the rates for the critical illness. All these are based on age. Here's the hospital indemnity plan. And now we're going to talk about your teeth. We kept this with Humana. We've got 2 different plans. One will give you $1,000 a year per person per mouth. One will give you $1,500 a year per person per mouth. You do have orthodontia in both, but if you've had any kids in braces, then it costs more than $1,000. So you've got, let's say you go in for preventative service, your twice a year teeth cleaning. So you go in and get your teeth cleaned and you've got a cavity. Let's just say the cavity is $200. So $200 minus $50 deductible on either plan 1 or plan 2. And then a cavity is a basic service. So 200 minus 50 is $150. You're paying 20% of $150. So that's $30. And the insurance company is paying 80% of $150, which is $130. And the $130 that they just paid posts against or reduces this $1,000. Math works the same on here, But as you can see in this example, 0% after deductible. So in this example, if it was just a cavity, then you are not paying coinsurance after your deductible on that particular service. Costs are down here, relatively inexpensive, and we kept it with the same carrier as last year. Biggest thing we did was medical. Here's vision, Humana. Okay, so when you have a $130 allowance for glasses, you walk in, pay your $10, and then you've got your lenses that go in the glasses for $15. Unless you're really blind like me, and you got to shrink them down. I'm not getting out for a copay. Or this once every means either or, not both and. So what that means is you can get glasses and frames, like lenses and frames, or contact lenses. They give you $130, not both at the same time. That's what that means. Rates are down here. Carrier is the same. Let's talk about some life insurance. So what we have is we've got employees, spouse, and kiddo. The amounts you choose for spouse and kid have to be tied to yours, so you can't get nothing on yourself and $100,000 on your spouse. And so there's a maximum of $300,000 or 5 times your annual salary. There is a guarantee issue clause if this is the first time you've ever heard it. If it's not, then you might have some paperwork to fill out. That's called evidence of insurability. So if you have sat through this drill before and said, you know what, I don't want it, and now you're going, you know what, maybe I do, then you'd likely have to fill out some forms for it. Those are called evidence of insurability, and we can get those to you if you'd like. Rates are down here based on age. And if you just love doing math, we want to give you that opportunity there at the bottom of page 27. But we have kept this with Humana, and we've kept the disability insurance with MetLife. Disability is insurance on your paycheck. So here's how that works. Short-term and long-term. Short-term insures, it's kind of interesting. You can insure 60% of your pre-disability earnings. Okay, so percentage of income replaced, $50 increments up to 60% of your weekly earnings. So that just means that increments are like, you're not going to get, you know, $55. It'll go 50, 100, 150, that kind of thing. But it's approximately 2/3, 60% of your pre-disability earnings, and it pays for 11 weeks, and it pays after 15 days for an accident or illness. So if you were injured and you needed to insure your paycheck against that, then this would be the way to do that. So that's what short-term disability is, 11 weeks. You've got a approximately 2 weeks, 15th day waiting period to receive benefits. And one of the things I tell folks all the time is the language, the contractual language on disability can get confusing and a bit technical. So if you're going, you know, I had this situation in the past, please just call us. This is what we do. So we're happy to explain it that is a little more specific to your potential situation. So just let us know if you have any questions, because this language can get confusing. We'd have a 4-hour-long webinar if we went through all of the fine print here, but we want to do a good overview that you can get a good concept in your head during this presentation. Okay, long-term disability kicks in after the 91st day. It goes to your Social Security normal retirement age, and it replaces 60% of your paycheck, or $5,000 a month. That's what that means. So long-term disability is much longer time frame than short-term. Long-term is going to be more expensive than short-term, because if you're insuring somebody's ability to get a paycheck up to Social Security normal retirement age, and that is usually going to be somewhere between 65 and 67 for most of us. So here is the cost broken out by age. Short-term disability is on the left-hand side. Long-term disability is on the right. So you take your weekly salary, the STD or LTD rate, and then you do that math, and then you'll get to your cost per paycheck. And so once you do that portion, if you have any more questions, please just let us know. MetLife has an app. which is pretty user-friendly. So you can see your coverages there. EAP does not cost anything, which is good. So this is a great referral service for you to use. You've got it through Humana here. And then we've also got legal services, which is also provided by MetLife. Or you can, MetLife sometimes these big insurance companies will use different, like just specific vendors. So Hyatt Legal Plans is the name who fulfills the legal services aspect of MetLife. Employee, spouse, and kiddos are available. Telephone and office consultations. So if any of these things that I'm circling right here are things that would concern you, or things that you would go, you know what, I'd really like to have an attorney be able to consult on that, we want to give you that option. So here's info.legalplans.com, get law, and it's $554 a paycheck. So pretty user-friendly way through Met to get some protection for legal. Premium only plan just means anything that we can not take tax, not pay tax on, that goes from River Subs to you. We won't, which is a good thing. That means you're not paying tax on any of these benefits, at least the ones that are eligible. Okay, rest of this, y'all, you kind of get a little glossy-eyed. I'm moving over it quickly. Here's the CHIPS information. The rest, honestly, is great late night reading material. Y'all know Amanda. She's great. Reach out to her with any questions. We back her up, but she knows her stuff. So let us or her know if you have any questions. Contact information is listed out there. And then you've got in this final page, all of the different carrier contact information, in addition to your dedicated representative, whose name is Ann, in our company. And here's her phone number. Let me see if I need to hit anything else. So we do want you to say yes or no. Please make changes. Last day to enroll is the 16th of September. How do you enroll? It's going to be done online. And we've got voluntary employee independent life. We do have some evidence of insurability. Just as I'm talking, just ask Amanda about this particular date, because we want to make sure that everybody's in the system. So ask her if you have any questions on the last date to enroll. That may be a typo or a date in the past. So we've got open enrollment running through the 22nd. I think we've covered it. So that's these glossary of terms. So if you get next to somebody you really didn't want to be sitting next to, you could just bring up this glossary of terms and they'll just walk the other direction. Thanks for tuning in. Have a good day. Please let us know if you have any questions. All right. Thanks. Bye-bye.